Hi, I'm Teri Casagranda. I'm a physical therapist here at Door County Medical Center, and it wasn't too long ago that I was in the class you're in right now preparing for my knee replacement surgery. I'd like to share some tips with you based on both my personal and professional experience as you prepare for yours. Bending your knee may feel a little intimidating because it's very common that the end range of motion with knee flexion is quite painful, so it's easy to be avoided, but this is a tip to help it not be quite so painful. You can scooch to the end of your chair and your knee will bend along with you. If that doesn't seem to feel comfortable for you, you can gently help with the other leg to bring it back. Now, when you feel the intensity of the stretch become quite uncomfortable, don't give up on it right away. Wait, and when that intensity goes down a little bit, you'll be surprised you'll be able to get a few more degrees. If you invest your time and your diligence on this, you can get a lot more range of motion out of the knee and flexion than you might have thought you could. Straightening your knee is just as important as being able to bend it, whether or not you're having a knee replacement or hip replacement, because you need to have a good straight knee in order to walk well. Putting your leg out in front, this is essentially a hamstring stretch on the edge of your chair, leaning forward with a good straight back. Don't let your back round because then you lose the stretch. Nice and straight. Now, if it's too uncomfortable to straighten it right away, start where you can, and when the intensity of the stretch becomes more comfortable, just ask for a little bit more. Take your time and be diligent. Now, another way to get good knee extension is to use another chair or furniture. Put your leg up on that furniture, keep your back nice and straight, lean forward until you feel a nice stretch behind the knee. Here again, you can just press down on the thigh a little bit to make sure that you get a good stretch. This stretch is intended to help you stand straight. It's important to be able to stand straight in order to walk. Initially, you'll have an assistive device and you want to be able to transition away from that, and it's a lot easier when you can stand up straight. You might be thinking, why should I have to be concerned about doing these stretches and things before surgery? I'm getting a new hip or I'm getting a new knee. And yes, that hip or knee is going to have fantastic range of motion, but you're still going to have the same muscles and other soft tissues that have likely become stiff, leading you up to this point. The pain, discomfort that goes along with standing and walking has led us to sit more. I know I've been there. We become stiff in the hip flexors and the hamstrings, and the calves get stiff. It makes it difficult to stand. All of that stiffness can also make us have some back discomfort. So this stretch will be hopefully helping you to feel better before surgery, lead you into a better place for surgery, and have a quicker recovery after. So all you need is a wall. You put your hands on the wall at about shoulder distance. Bring one leg back, and you can do both sides, but this is my operated side. Look down and make sure your toes are facing forward. It's often that one is going to cock out to the side, but keep them both going forward, and then gently lean into the wall and look up. This will give you a wonderful stretch in the front of that thigh, a great calf stretch, as well as a nice stretch for the low back. And just hold that stretch for about 20 seconds. Make sure you're breathing. Go to a comfortable place. If you have discomfort, wait, breathe, and if that intensity of discomfort decreases, just go a little farther and get a good stretch. I hope you find these tips helpful, and I encourage you to be diligent with your part in getting your range of motion where it needs to be. We're there to help you, but you're part of this team. Thanks for listening. See you in rehab.